And Dr. Ellison, thanks very much again. And I'll go ahead and throw it to you. You're a co-host, so feel free to share your slides and take it away.
Thank you. I decided that I wouldn't use any slides today because I think people are overtaxed with PowerPoint presentations. So I'm going to just chat a little bit and then put it back in on you to chat with me and ask questions that I can answer for you. One, I want to thank each of you for spending time with me today and getting up a little early, your time to participate on this call. I'm excited to have this opportunity to chat with you, and I certainly hope the information that I share with you will be helpful as you move through your journey to become medical doctors. So let me just say a little bit about Chicago Medical School. Of course, you know we're located in the Chicagoland area. If you're thinking that we're in the heart of the city, we are not. We are north of the city and we sit between Chicago and Milwaukee. We are in the northern suburbs of Illinois. Our school sits in, I think, a very unique um, area. About 3 blocks, one direction of the university is one of the most wealthy communities of Illinois. And 3 blocks in another direction is one of the most poorest communities in Illinois with a very large Spanish-speaking population. And then directly next to the medical school is one of the largest medical facilities for veterans and military personnel and their families. So we kind of sit in a unique place. We think that's a positive thing because it really allows our students to truly engage with the community, not only the community that may be underserved, but also the community that has a lot more resources. And then being in the city of Chicago, our students get an opportunity because we are a community-based, community-engaged medical school, meaning that we don't have an academic medical center attached to the medical school. Our students are trained throughout the Chicagoland area and suburbs, urban environments, rural areas for their education. So we think that's a plus. And when I travel to California sometimes with the dean and I talk to some of our alums, they really highlight that that was probably the best thing for them. One, being able to train at a variety of different hospitals, clinics, and healthcare systems, being able to learn many different medical record systems, and having the fast pace of working with interdisciplinary teams that it helped them significantly when they were interviewing for residency spots and when they started their residency um, work. So that's a little bit about the university itself. Our curriculum is like most medical schools. It's 4 years. The first 2 years is basic science coursework with an introduction to healthcare and clinical rotation. So your very first quarter at the medical school, you'll be going out to do some observations, and you'll do the same thing in your second year. And then your third year, which is phase two of the curriculum, that's your clinical rotations. And you'll spend that third year, like most students, doing all of your rotations. And I think there are 7 or 8 mandatory rotations that you will do third year. And then fourth year is what they call phase three of the curriculum that will be focused on your residency preparation and doing a number of coursework, elective coursework that will help you strengthen your application for your residency. That may also include something with research as well, depending upon what you're choosing. So I think you'll find the curriculum to be a solid curriculum. You'll find that most medical schools are moving away from all lecture-based information. And so we do a variety of different learning modalities from some being mandatory in-person meetings to small group, case-based learning, problem-based learning. Right. So let's talk about the important part. Now, getting into med school um, really isn't difficult, but I'll just share what most schools are going to be looking for. Every school, I think, is doing some version of what we call holistic admissions or holistic review. And with holistic review, holistic admissions, we're looking at three things: your experiences, your attributes. What are you going to bring and contribute to the medical school and the profession of medicine? And then lastly, your metrics. Now, I wish I could say that metrics was, not critical. It's not the first thing we look at, but it is something that every medical school is going to look at. They're going to look at your metrics, one, to see your readiness to manage and handle the rigor of the coursework that you're going to do in med school. Are you going to be able to get through the curriculum without a whole lot of stress and burden? Or are you going to burn out after the first semester in med school? So they're going to be looking to see, can you handle that? And basically, the AAMC has provided medical schools with a lot of information in terms of how students will perform when they're in medical school based on two things: your MCAT total score and your GPAs. And so it indicate to us how successful students will be in their journey in med school. So it tells us and gives us information based on those two things: how many students are going to um, excel and be on time to graduation in 3 years, 4 years. How many students, or the percent of students who are going to get through step one on first attempt or second attempt or beyond. And then the same thing for step two. So the MCAT score and the GPA is important. We certainly aren't looking for students who have 528 MCAT scores and perfect GPAs. I can tell you that we have denied students who have had perfect GPAs and perfect MCAT scores because they did not demonstrate those other things that we're looking for: the experiences and the attributes that you're going to bring not only to the learning environment, but to the practice of medicine. So you got to be that whole package. And so experiences, attributes, and metrics. I have spent a lot of time this spring and summer doing post-counseling with students who may not have been successful the last cycle. And I shared with most students that medicine is evidence-based. And so what the medical schools are going to be looking for is evidence of your motivation for wanting a career in medicine. And two, why? What do you hope that you're going to do as a practicing physician? What do you hope to see? Do you hope to improve healthcare outcomes? Are you looking to educate patient populations to reduce healthcare disparities? Are you looking to help create new policies? Are you looking to be more advocates for the patient population that you're serving? Are you looking to find new tools and techniques to improve healthcare outcomes? And so that's what we're looking for. Where's that evidence? When I was a pre-health advisor and I would read through the application of students, and they would say to me, "Well, Dr. Ellison, I want to be a pediatrician." And when I read through their application and everything, there was no evidence that you like kids. You've not tutored any children, you've not worked with any kids, you've not worked as a summer camp counselor. You've never, nothing in your portfolio did anything with children. And so the same thing I think applies to you as future physicians. How do you show evidence that you are truly motivated to become a physician, and that you have those competencies that I'm sure all of you have from AAMC, that says this is what we're looking for, the pre-med competencies? I think there are 15 or 17 competencies. So how do you demonstrate and show evidence of resilience? And how do you demonstrate your ability to work well in a team? And how do you show integrity and empathy? So all of those competencies and the things that you submit in your application is what we're going to be looking for. So if you only have 30 hours of healthcare experience, that's not going to tell us very much about your one understanding of the healthcare system or what it's like for people who are sick and their families. So they're looking to see, have you shown evidence that you know what the healthcare system is like, what you're getting yourself into? That you had direct patient contact, that you either worked as a scribe, a medical assistant, an EMT, you were a transporter in the hospital, you did things more than the passive thing of shadowing. So I see many applicants who submit their applications, they got like 900 hours of shadowing. That's very passive. It's not you doing anything to help anybody. Remember, physicians are servants. They're there to serve and to help others. So how are you going to demonstrate that quality that you want to serve others and to improve the lived conditions of the people that you are entrusted with?
Hey, Dr.
So,
Ellison, I'm glad you bring up shadowing, and I'm wondering, I think you raised this last year, and it became a message that I was communicating to my students as I was advising them throughout last academic year. Um, you pointed out last year, and you just kind of underscored it again today, that there's a diminishing return on investment where shadowing is concerned. It can be a valuable and even formative experience, but at some point, like you say, it's passive. You're a potted plant effectively, particularly if you're in clinic. At what point do you say the ROI on shadowing? Is there a number, where you're like, yeah, okay, I think you're good with the shadowing experience?
probably if I were advising a student, the only reason I would advise the student to shadow is if you wanted to understand the role and responsibilities of the specialty that physician practices. So if you wanted to understand more about primary care, OBGYN, or a surgeon, or someone who's in radiology, or ophthalmology, or any of the other specialty areas that you have an interest in, I think it's ideal to do some shadowing, but probably more than 75 hours. I think you could use your time better by doing something that's going to allow you to be patient facing. And so again, the big thing that the schools want, and again, numbers are important, but more about the quality of the experience, which is important. So again, for healthcare and clinical, it's about you understanding medicine and patient care and the healthcare system. That's what they want to be able to assess. How much you know about the healthcare system, about patient care, and understanding medicine. And so as you undertake these roles, that's what you want to always keep in mind. How am I going to be able to demonstrate those three things? That I understand healthcare, I understand patient care, and I understand the healthcare system. I think that's very important in doing so. I wish, every school looks at things a little differently. There isn't no magic number of hours, but, think about it. If you are a student who has said that I wanted to become a doctor when you were in high school, then one would probably expect a little bit more from you in terms of your experiences that will lead you down this path than they would someone who said in their senior year they had an epiphany that medicine is for them. Because now they're just turning over and saying, hey, this is what I want to do. And so I would expect them maybe to have fewer hours, but still have a sizable number by the time that they matriculate. So again, when I read personal statements, I'm looking at when you said this came to light for you. And so if you're telling me that you wanted to do this since you were 12, then I'm going to be looking at the progression of things that you've done. And if you didn't start doing anything until your senior year, then I'm going to question your motivation a little bit. All right. So healthcare is important. Service is important too. And service beyond things on your campus. You want to demonstrate that you are looking to help those who have the greatest need, whether that's people economically disadvantaged, educationally disadvantaged, senior citizens without family members, working with children, working with disabled people, working with those who are housing insecure, working with communities when there are natural disasters. And in California, unfortunately, I hear so often about um, these fires and mudslides and floods and all of these things, which I think would be ideal to say, I participated. I did something with Red Cross. I am a part of the American Diabetes Association. Educate children in high school about, eating well, um, working out so that they can maybe not become a type 2 diabetic. So all of these things, I think there's so many things that you could be involved in. I know many of you are involved in your clubs and organizations on campus and you do really nice things with fundraising. But I think when you do things that are outside of your organization and sometimes even outside of your comfort zone, um, I think that shows a lot about cultural competency to the medical school that you have worked with individuals who are different from you and who've had different lived experiences. So as you become medical students and medical doctors, hopefully it will give you a broader perspective of the diversity of patients that you might see and understand when you have a patient that may not be compliant with their medication regimen. So again, I use this example all the time. If I am a type 2 diabetic and I'm required to store my insulin in the refrigerator, but I am housing insecure living in the park, where am I going to store my insulin? Right? So just being mindful, or why is the patient missing their appointments? Well, if I got to take 5 buses to get to your office, that means I might be late. Or sometimes if the bus is not running or there's an accident or something, I may not be able to be there. So, do you understand those kinds of things? And do you look at ways of how I might be able to help this patient whose experiences are different from most still be able to manage their care in a way that will improve? So, again, these community service activities really kind of do two things. It truly shows that you are a person who want to improve the lived experience, not just in healthcare, but in any way that you possibly can, and that it is a part of who you are. I'm not doing this because I want to check boxes. I'm hoping that when you do community service, that you're doing something that you are truly passionate about and want to see be able to help. So whether it's, feeding the hungry or in Chicago, we have these things called seasons. And so many of our students will do things to provide, particularly women, with personal hygiene goods. Because how do you take care of things that your body does on a monthly basis and you don't have the materials that you need? So students will do care packages, go out to areas where there may be more women who are housing insecure and give them things like sanitary napkins or tampons and deodorant and maybe some lip gloss so maybe they'll feel better about themselves. So again, just thinking about how I might be able to help in a way that people don't think. And then lastly, about the service thing, even in your clubs and organizations, we have the tendency to say what people need as opposed to asking people what they need. So maybe if you're going to work with a vulnerable population, as opposed to you making the decision what they need, maybe you ask them first. And then you can build your campaign so that you are fulfilling your mission and you're providing those things that they truly need, right? Okay. So healthcare, service, of course, leadership. Students ask about research. Research is nice. And if you are planning to do an MD, PhD, you certainly should have significant research that you're able to talk about and more than likely have be a co-author on a publication with a faculty member or the principal investigator. However, I don't think for us, we're a community-based medical school, so you don't need 10,000 hours of research. You can certainly, if you have a desire to do research, I've read a number of students' personal statements who engaged in research because maybe they had a family member who was struggling with an illness or had a disease that they wanted to learn more about. And so they felt this would be a good way for them to understand their loved one or friend. So that may be it. There are other individuals who want to be physician scientists. And so if you're writing in your personal statement that you have an interest in becoming a physician scientist and there's no research there, then again, where's the evidence? You know, you're all too young to remember this commercial for Wendy's, but there was a senior citizen, old woman who said, "Where's the beef?" So for medicine, where's the proof? All right. So everything that you do, ask, how am I going to be able to demonstrate this? How am I going to show evidence of this? And then lastly, well, let me change that. Not lastly, but in addition to, um, examples are important. Remember the people who are reading your applications and your personal statements and your supplemental applications. They don't know what's in your head or what you're thinking. They can only read what you put in writing. And so if you are not clear in stating what it is that you did or what you gained from these experiences, how have you grown from your freshman year to your senior year? We don't know because you didn't tell us. One of the biggest, um, I won't say mistakes, one of the biggest things I see when I'm looking at the experience section on the AMCAS application, it asks you to describe what you do in that experience. And students are not doing that. They're telling about what they gained from the experience, but they're not saying, "Oh, I worked with 5 patients every day that I was there. I took vital signs. Um, I recorded the information for the physician. I gave patients educational pamphlets. I answered questions for them." None of that. So I can't assume that you had direct patient contact if you don't tell me and you don't give me examples of what you've done. So when they ask you to describe the role, tell them exactly what you did in that role. And then if it's the most memorable, I think you get an opportunity to identify 3 of the most memorable experiences. Then you could talk about what that experience did for you. But don't do it in the description, at least not totally, because now we're not gonna know what you did, and now it's gonna leave us wondering. And then if I go back and look somewhere else and I can't find that, then I'm like, oh, I don't see it. All right, so follow the directions, and then on the supplemental application, you got to look at the school's mission and vision and values. And you have to figure out, how do I make sure that I'm in alignment with the mission of the school? So here's an example. We have a school in Illinois where their mission is to train and educate future physicians who are going to work in rural Illinois. So if in your application you're talking about working in urban environment or suburban environment, or I want to work in California, why would we invite you to interview when there is no connection to our mission? All right. So you want to make sure that you are in alignment with that school's mission. And then the other part, particularly for a school like Chicago Medical School, we are a community-based medical school. We know we get a ton of applications, and everybody's going to say, I want to go to Chicago Med School. And you would be foolish not to say that. But we know that not everyone wants to come to Chicago. And if you got admitted to a California school or somewhere that's close to your support base, more than likely you're going to choose that school. And so, again, if you went to school in California, you were born in California, you've never been outside of California, you don't talk about traveling abroad or doing anything, is this student really interested in coming to the Midwest? Where's the connection? Where's the tie? And even though you may have never lived in Illinois, you never lived in Chicago, you may be talking about maybe the patient population that's in Chicago that may be similar to a patient population that's in California. So find a way to connect genuinely and authentically. So let me look at my
So
notes.
I'm wondering if a lot of the stuff you're talking about with secondaries and primaries, that's probably most of the kids have already submitted, right? But I love your point, Dr. Ellison, about examples. The thing I tell my students over and over again, and it's as applicable in the interview process as it is in the secondaries. You say examples. I use stories. I say stories are what's going to be memorable about you. If you're talking in the abstract about being detail oriented or having a heart for the vulnerable populations, those are fine notions, but they're in the abstract. When you're citing examples, or as I say, tell stories, don't be willful in working stories into an answer to an interview question, but those are the things that really will resonate with an interviewer when that time comes.
Excellent. You're absolutely right. And so then I guess the next part of our discussion should be if you are invited to an interview. So when I was a pre-health advisor, I would tell my students, if you've been invited to an interview, you've basically been admitted. Now we're trying to figure out why we don't want to take you. So don't give us a reason. Um, so what people are looking for on interview day is a couple of things. Your ability to communicate. And I can promise you every interview day, when I greet the group of 36 candidates that are interviewing that day, the first 10 minutes is painful because no one wants to talk. No one wants to say anything. I'm like, come on, smile. You're interviewing. You should be excited. Show some enthusiasm. And I'm saying to the group, this is the opportunity that people are going to assess your ability to communicate. As a future physician, you're going to meet patients for the very first time, and they're going to be meeting you for the very first time, and they're going to be nervous, and they're not going to want to share information that you need to make a diagnosis and a treatment plan if they don't talk. So if you don't talk, the patient doesn't talk, you're not going to be productive. And you don't have 2 hours to kind of warm up and get the patient warmed up. You got 20 minutes maybe. So on interview day, as nervous as I know that you might be, you got to work on that. Because how do we assess your ability to communicate if you don't talk? How do you demonstrate your interest in that medical school if you don't talk? And how do you show your interest if you don't have any questions? So you should never go to any interview, whether it's for medical school, residency, um, a, a job interview without having questions. And again, nothing that you can pull off the website, but you should want to ask something. So one, you demonstrate that you have an interest in that school. And because most schools are still doing virtual interviews, it's really difficult to kind of really get the full sense of who you are in the little box that we get to see. And so I think it is important that you realize that one big element of the interview day is your ability to communicate. The other part of the interview day is, again, people are always going to be looking for your motivation for why you want to be a physician. They're going to be looking at your ability to think quickly on your feet, to be able to problem solve, to demonstrate resilience, the ability to show that you work well independently and in a part of a team. And are you adaptable? And just recently, our dean of student affairs was sharing with me. He said, Michael, how can we assess whether students are going to listen to advice and follow it? I'm like, gee, that's a good question. I mean, we try to assess that, but clearly students are coming to med school. You're meeting with advisors and mentors, and they're sharing things with you, and you're not taking the advice. How do you think your patients, how are you going to feel if you give advice to your patients and they don't follow it? You're going to be a little put out about that a little bit, right? So again, one of the things you'll hear a lot in medical school is about self-awareness, self-reflection. Do you grow from your experiences? And the one thing you'll hear again if when you get an interview is that you got to stop thinking that making mistakes is a bad thing. We learn from our mistakes, or I call them lessons learned. So, no one is perfect. You will not know all the information that you need to know as a physician. So if you're not willing to talk to your peers and your colleagues about things, how are you going to give the best care to your patients? So you got to learn to say, I don't know everything. I know that I was at the top of my class in college. And it's okay if I come to med school and I struggle a little bit. It's okay if I'm not getting 100 on every quiz and an exam. And I always tell students this when you think about this, when you go to your doctor's office, do you see their transcripts on the wall? Do you ask them, well, what grade did you get in anatomy? What about biochem? What about organic? Do you ask them, what was your scores on the step exam? You see their diploma and you know they have a license to practice. And if they didn't have those two things, they could not be providing care for you. So I hope that if you are one of those students that are just really competitive and you have to have the highest grade and the highest score, that's not what medicine is about. Medicine is about treating the patient, improving their lived conditions. And when someone is really sick, they don't care about whether you were at the top of your class. They want to know if you're going to be able to provide the best care for them.
So, Dr. Ellison, if I can jump in here, I want to be mindful of your time, and I also want to make sure we have allocated time for students to ask you questions. I just was looking at MSAR, and last application cycle for out of state, I noticed there were 9,700 plus out of state applicants to Chicago Med. You interviewed 429 of them. So you do a lot of thinning of the herd up front. And you mentioned a few minutes ago, if you're interviewed, you're virtually accepted. You just got to not fumble the ball near the goal line, right? But can you talk about just briefly your timelines? Students, as much as I tell them not to pay attention to it, they'll go to pre-med, Reddit, or SDN, and they're like, oh my goodness, it's Thanksgiving. I don't have an interview invite yet. I'm toast, right? Can you talk a little bit about your timelines? How late in the cycle are you interviewing kids? How late might you expect to hear about an offer from Chicago Med?
Sure, we interview from September to April. And I was just having a dinner with a colleague last night from another medical school, and we were both lamenting about all of the applications that we process. And it's a small number of people who are doing the work. So, students sometimes are a little anxious because they don't hear anything immediately. So you may submit your application in advance. You may submit it well before our published deadlines, and you still may not hear anything for a little while. And you may not get a notice about being invited to an interview to maybe December, even January. So we're still sending out invitations for students to interview as late as March, mid-March, because I think our last interview day is maybe April the 8th or
Okay.
9th.
Great info. So, I tell students all the time, this is a marathon, not a sprint, but it's great to hear that reiterated from somebody like you in a position of knowledge,
But
right?
it doesn't mean that, even though a school's deadline is November 1st or December 1st, that you're submitting it on
Oh
that
yeah,
deadline.
deadlines. I tell my students no. It's not. Do not pay attention to deadlines. I give them graphic information that shows you get your timely, stuff submitted. It will have downstream effects. So deadlines. Tell students pay no attention to school deadlines.
Early
Okay.
applications,
Yep.
because towards the end of the cycle, schools could be a lot more selective on who they're going to
Yeah.
invite
For
to.
sure. For sure. All right. I'm going to stop the recording.